Methodist Hospital Sugar Land is known for its regular seminars on timely health matters, and the month of March was no exception.
Well, this is colon cancer screening month, and it's one of the cancers that are very common but totally preventable. Unlike other cancers that you do not discover in a phase before it turns into cancer, colon cancer has the advantage, unlike prostate or breast cancer, to be picked up before it even becomes a cancer. And it's a fairly common cancer. It afflicts about 1 in 20 people. So every year you will have 130 to 150,000 people have colon cancer. And by a mere simple test called the colonoscopy, you can prevent the development of colon cancer by finding polyps that are precursors to cancer, and a physician trained in the specialty will be able to remove it through a scope. The current recommendation is that you have a colonoscopy done once every 10 years, starting at the age of 50, for African Americans the age of 45. There are certain conditions where you may need to do it earlier, like family history of cancer. And if they do not have a polyp that is precancerous, then they could stay on the 10-year routine. If, however, they make polyps, then they are at a higher risk, because polyps in itself are a risk for colon cancer, and they may need that test done every 3 to 5 years.
So today we're talking about two different things. One is going to be screening for colon cancer. And unfortunately, if you find something on that screening, it's going to be the eventual management, which is surgery, and that's where I get involved. Unfortunately, surgery is surgery. So the way we approach that surgery can change from time to time. Most of the time we do our surgery through smaller holes, what we call laparoscopic or minimally invasive. There is this fancy new robot that we use occasionally also to do the surgery. And then there's the tried and true. I hate to use the word old-fashioned because it's not old-fashioned. It is the gold standard, which is the open operation. But thankfully, we don't resort to that too often. The biggest thing is fear. It's very intimidating when you come into the surgeon's office and you hear that you're going to get general anesthesia, you're going to be in the hospital, there's a big operation. It's an operation for cancer. What is the next step? What is the next level? And there it's important we address those in the office. And the best way to do that is to tell the patient that, hey, you're going to have a great surgical team. You're going to be at a great facility where the operation is going to be done. The nursing care is superb. And every step of the way, there'll be someone with you. And I think that's really the most important takeaway.
No, I think the important thing is for people to understand that this disease is a combination of genetic and environmental factors. The genetics we cannot change, but the environmental factors we need to go home and work on every day. All the good things that you can do for your heart, for your liver, for your lungs, for the rest of your body also helps your colon. If you consume a diet that is high in fiber, high in fruits, high in vegetables, limit your red meat consumption, limit your saturated fat consumption, all of those factors will improve your risk as regards to colon cancer.
For more information about upcoming events at Methodist Hospital, go online to houstonmethodist.org. For Healthwise, this is Randall Williams.